It's time for a doctor's checkup. When we first met April, she had lost 280 pounds in 3 years. This mom was motivated to keep up with her 2 children.
I really don't remember a time not being overweight. One of my low points was my daughter was just learning to walk. I was sitting on the couch and my mom walked over to her to help her walk because I wasn't able to get up. At that moment, it was like a breaking point. So I joined the gym. That's when I stepped on the scale and saw that I was 440 pounds. And that is the highest that scale will ever be.
April, come on out. How much weight did you lose?
I lost 280 pounds over the course of 3 years.
April, you are here today on a show called The Doctors, and we reached out to Dr. Tamir Mosharrafa, and he's agreed to give you this skin removal surgery you need for free.
Whoa!
Our cameras followed April as she underwent her skin removal surgery.
The amount of freedom of movement I'm gonna have is the arm part is gonna be gone, and I like to hit, and I like to dance and jump around, and not having that move around will be surreal.
Today, we're doing a lateral thoracoabdominoplasty, a lateral thigh lift, breast implants, and a brachioplasty, or getting rid of the excess skin of her upper arms. My guess is that we'll probably remove about 10 pounds of skin total. It's gonna be a really dramatic change for her. And we're working our way down from her armpit down towards her hip, removing the excess skin. So this is what we've removed so far. Because her legs got smaller with the weight loss, she has more skin than she needs to cover the upper thighs. This is all the skin that goes from her armpit down to the outer part of her knee. You can already see the change in her contour here. And here's the piece of skin that came off of the arm. All that excess redundancy is gone. And compare that with the left side, which we have not yet done, which still has all this excess skin. The last step of the surgery is the breast implants. We're going to put in silicone breast implants to restore some volume that she lost when she lost the weight. The device goes in a little bit like a pastry bag, and voila, this is it. This is the last stitch, and we are done.
Who is ready to see April?
We are!
A quick reminder of what she looked like just 3 years ago. April, come on out.
Amazing.
What a long way you've come. April's plastic surgeon, Dr. Tamir Mosharrafa, joins us as well. Are you happy with the results? Because you look stunning.
I am very, very happy with the results. I'm going to be able to start working out again very soon, so I'm very excited about that. And I'm excited to get back to life and the gym and all that kind of stuff.
Well, and Dr. Mosharrafa, we have to talk shop a little bit.
Sure.
Big case.
Yeah,
And
two big cases.
you took on a lot in that first stage. How long was that first surgery?
First operation was 10.5 hours.
I believe it. You do a lot of this post-weight loss surgery. Everybody's a little bit different. Distribution of that loose skin, where it presents itself, the folds. So tell us more specifically what your game plan sequencing was with April.
We wanted to strategize such that we wouldn't have one operation necessarily conflict with another. So the first operation, you saw it in a lot of graphic detail there, was really addressing her arms, which were April's #1 priority. We wanted to make sure that we treated the thing that bothered her the most first, so that was taken care of as the very first operation. And then kind of down her sides. One of the things that's important about these surgeries is that these are three-dimensional operations, right? When April lost her weight, she went from being a larger cylinder to being a smaller cylinder. And so we can't just treat skin in one plane. You have to treat this in sort of multiple planes. And so a tummy tuck and a body lift is a great operation for some patients, but it really doesn't address the transverse redundancy. And so that's why April really needed these scars down the sides and down the sides of her thighs to treat her in a three-dimensional way.
April, I heard that you have a new man in your life.
I do. We were friends for a bit, and during one of the hospital stays, feelings happened, and we started dating.
Wow.
Well, I know this has been a heck of a recovery for you. And again, I think we all watched what a remarkable surgery, in this case, 2 surgeries. We also know you're in the market for some duds. So our friends at Crosby by Molly Birch want to give you $1,000 worth of new clothes for free.
Thank you. Awesome.
And
Thank you.
I would just wish you nothing but the best going forward. Enjoy your life, enjoy your kids, enjoy your new romance, enjoy life, because you deserve this and you earned this. And Dr. Mosharrafa, we can't thank you enough as well for taking such
Great
diligent
work.
care
Thank you.
of April.